All right, good morning, everybody. Welcome to our Academy live Q&A. Today, we chose the topic that is a fundamental topic and has been super prevalent in our community, which is understanding the functions of behavior or understanding why the behavior happens in the first place. I always talk about that in order for us to know how to support your child or for you to know how to support your child with challenging behaviors, it's important to know why the behavior happens in the first place. The reason for this is because without knowing why the behavior is happening in the first place, intervention can be very ineffective. So, for example, I know that parents sometimes will use timeout as a consequence for kids engaging in quote unquote bad behavior. Say a kid hits another kid and the kid is put in timeout. The next time the kid is encountered with this situation, whether it was a toy they were fighting for or whatever it was, the reason that he hit, next time he's encountered with that situation, he's likely to hit again, as opposed to that timeout serving as an appropriate consequence for stopping the long term hitting. That is because we don't understand why he hit in the first place. What was the reason or the function why the hit happened in the first place? It could have been that the kid was frustrated at what the other kid did. It could have been that he didn't have the appropriate communication skills to voice whatever he wanted, whether it was a toy or he was frustrated, or it could be any other reason. But without knowing why that happened in the first place, the timeout will not solve or teach that kid what to do instead in the future. And that is why that hitting continues. So maybe imagine that you go to the doctor with abdominal pain and they send you home with some laxatives because the doctor hears that, I don't know, you haven't had a regular bowel movement in 2 days. And so they send you home with some laxatives. But the reality is that the pain is coming from you having kidney stones. So the pain is not going to go away with the laxatives because that is not the root cause of your pain. It's the same for behavior change. Without really identifying why it's happening in the first place, any strategy or any intervention that we try might be ineffective. The reason why it's important and to make sure that we know why the behavior is happening in the first place is because this allows us to have more targeted intervention. So knowing the root cause really allows us to come up with the interventions that are very targeted for that particular reason for that particular child. It also allows us to work on prevention, which is a very important part of behavior change or behavior intervention. A lot of the strategies that we work on are preventative as opposed to reactive or consequences. So if we know why it happens in the first place, we have more options to prevent those triggers or prevent those situations. It also allows us to focus on proper reinforcement. Behavior that is not properly like reinforced and praised and actually maintained in that, kids repertoire of behavior doesn't stay in the long term. So I'll give you an example. If you were to go and work out every day for 6 months, a year, but you didn't see any change in whatever goals you had for your fitness goals, then you're not likely to continue with that behavior of engaging in those fitness goals. But if you were to see that change in how you feel, in your body, in your goals, then you're likely to continue with that fitness journey. It's the same for a kid. If they're not properly reinforced for the right behaviors or the behaviors that we want to see more of, then the behavior doesn't stay. So that's why it's so important to know why the behavior happens in the first place so that we can reinforce the right ones. Another important reason why is important to know why the behavior happens in the first place is because it allows us to individualize treatment to that particular child and to those particular circumstances, whatever they may be in. Um, Another important point to know about why it's important to understand the reason for the behavior is because behavior rarely happens for one single reason. People behave the way they do, usually for multiple reasons at once. So there's simultaneously multiple variables happening at the same time. So, for example, when you eat, you do it to avoid the pain of hunger and also to access or enjoy the delicious food, the pleasure of eating the food. And this is important to understand because effective intervention for behavior addresses all of the reasons and adapts to them in real time. And I'll give you an example. I had a client who engaged in vocal perseverations. Vocal perseverations are when a person repeats a sound or a word over and over and over again. The vocal perseverations for this child were for different reasons. Sometimes they were in response to something that was a triggering anxiety or nervous event. Other times he did it because he was trying to avoid something that he was asked to do. And other times he did it because he wanted to access a certain place. Like if he wanted to go to SeaWorld or an escalator, he would repeat it over and over and over again. We noticed that if we got the reason wrong, so for example, if we address the vocal perseveration or that repetition, when he wanted to access something, and we responded as if he was trying to avoid something or he was anxious about something, intervention did not stop that vocal perseveration at that time. Luckily, we got really good at identifying in that moment the reason for that particular vocal perseveration, and we were able to intervene accordingly. But that required that we identified in that moment why that behavior was happening in the first place so that we could intervene accordingly. So, that is very important again to understand and to know that there are multiple reasons always playing a role in a behavior. Understanding that and knowing that in the moment allows us to identify something that is actually going to work for stopping that behavior, not only in the moment, but long term to teach that child the more appropriate ones that we want to see. Another important point to know about the functions of behavior or the reasons for behavior. Oh, I see a hand.
Yeah, Elami, we got some questions in the chat regarding
Awesome.
the function of behavior.
Sure.
So we got a mom that's asking. She's like, she understands that what the getting the function of behavior is, but she wonders if it really matters in really helping the child to get it to stop.
Good question. So, like I mentioned, in it definitely matters to understand the reason because if we don't understand the reason, whatever our response to that behavior is we're kind of like gambling with a response, if that makes sense. If you don't understand why, whatever you do, you're guessing. You're doing guesswork instead of actually knowing how to respond to that child. And so it does matter for that reason.
Cool, thank you.
Does that answer the question?
Yeah, I'll let you know if any more come in the chat.
Okay. And I see another one that says, how do I figure out the root cause of my child's challenging behavior? And that is a great question. The first step is always observation, paying attention to when and where the behavior happens, what happens before and what happens after the behavior. I always recommend that you keep a journal or a place where you can write down, oh, this happened and it was during this time. These people were present. This is what was said. And that helps us keep a record and look back and identify some of those patterns. Yeah, I see.
Yeah, so we got another one. The parents asking if my child is hitting because they want something, why can't I just teach them to stop hitting instead of trying to figure out what it is that they want?
Yeah, so you can teach them to stop. However, if you want that behavior of hitting to ask for what they want to change in the long term, then hitting teaching them to stop in the moment is not teaching them what to do in the long term. So think of it as two ways. You can teach what to do in the moment, which is the stop, but if you want the behavior to stop in the long term, you have to teach that child that alternative. So instead of telling them to stop, you're going to tell them what to do instead. So, for example, in the moment, you instead of telling them to stop, you can tell them, if the child is vocal, you can give them the word. So, for example, if they're hitting you, they're tapping you or hitting you to get an apple, you can tell them apple and model it for them, instead of telling them to stop. Now, if the child is not vocal, you can teach them to point or to reach, any other form of non-vocal communication that tells you what they want without the hitting. But that is the biggest difference between teaching them to stop versus teaching them what to do instead. That teaching them what to do instead tells them how to behave in the long term, versus stopping just stops that behavior in that moment.
Gotcha. I have another one in the chat. It says, I've tried watching my child's patterns, but it seems totally random. Sometimes my child listens just fine, but sometimes they don't. How do I make sense of that and figuring out the function?
Mhm. Sometimes some behaviors take longer observation to understand. This could be because the behavior has been happening for a long time, it has a long history, or it's been responded to very variably, which could be why you are seeing this. Basically, when it happens, people in the environment or the environment itself reacts differently. So I would recommend that if you have been watching and observing and actually writing it down, that you observe for longer, and you will find patterns in those behaviors when you have enough information to go off of for that particular behavior for that particular child.
I think you kind of answered it in that one, but we got another question saying, um, what if there is no reason at all? So I presume that there is going to be a reason, even if it seems like there isn't one.
Definitely. Sometimes the reasons are not obvious to us. There could be something internal happening. I always recommend that you look at other things, like, for example, how sleep, how is food intake, liquid intake, basically hydration, hunger, because a lot of irritability or those behaviors that seem random do show up because of other causes like lack of sleep, hunger, all of that. I have had clients in the past, for example, who have had seizures that are not visible to the naked eye. And so, if you consider that, I'm not saying, of course, that every child will have a seizure, but just as an example, if you consider that if a child is having a seizure and it's not visible to us, that's an internal event that happens that could be the reason why later on we are seeing more behaviors. So there's always definitely a reason. We'll just have to watch closer at what correlates with those behaviors. Sounds like that answers that question.
Yeah, you can keep going.
Okay, awesome. I got another question on the reason. It says, how do I respond when I'm unsure of the reason behind my child's behavior in a particular moment? And that is a great question. If you are unsure about why your child is engaging in that behavior at any particular moment, the best thing that you can do is to stay calm and observe. Just kind of try to take a step back. I know every possible triggers that could have happened, know any possible reasons that could have played a role into why it happened in the first place, and then act accordingly. Again, if we act reactively without really knowing what happened or why it's happening in the first place, we are doing just guesswork. So it's kind of like a 50-50 chance that whatever you're going to do is going to be effective. So I really recommend that you stay calm and observe, and if anything, just offer calm presence for your child, being there for them. Yeah, just being there for them, being present and offering comfort is probably the best thing to do in that instance. Okay, so if any other questions come up, do let me know. But the other point that I wanted to talk to you guys about is actually what are the reasons of behavior, right? We know it's important to understand why the behavior happens in the first place, and it's important because we need to identify the right thing to do or the right intervention. Now, what are the reasons? There's four main reasons. It's an acronym called SEAT. It's sensory, escape, um, attention, and a tangible. So sensory seeking could be something like, they need input, they need squeezes, they're just wiggly, fidgeting, moving around. Escape is when they're trying to avoid something that they don't want to do. Attention is when they're actually trying to get attention from somebody or the environment. And then a tangible is when they want an access to actually something that they can hold, a toy, food, something like that. Now, I always like to include two additional reasons. These are from the body brain connection. And one of them is a need for safety and a need for connection. I actually think that those two are foundational. I look at those two first and then look at the other four kind of like on top. A child always needs to feel like they are in a safe environment. And a lot of children with developmental disabilities like autism, ADHD, intellectual disabilities, or any other genetic disorders of this sort, do have what is called a faulty system of identifying threat. So even when there is no threat in the environment, their nervous system might identify it as something that is threatening. This could be as simple as me giving a demand and their nervous system, or an instruction that they don't want to do, and their nervous system identifying that as threatening, which is why they respond in that behavior, whatever that may be, tantrum, aggression. So, what we want to address is really making sure that that child feels safe in that environment, and that we are connecting with them first, that we're building rapport, that they know that we're there to help them, that we have a connection with them, talking to them, really getting to their level is so important to understand. So these are, again, the four functions, and then the additional two from the body brain connection, which is need for safety and need for connection. I see another question that came up. If my child is engaging in a behavior for multiple reasons, how can I figure out which one to address first? And that is a wonderful question. When there are multiple reasons playing a role in a behavior and you know what they are, the most important part on what to go for first is the one that is basically most disruptive, or the one that causes the most distress for the child. So, for example, if a child is tantruming because they want to avoid something, but then they also want your attention, you have to pick whatever is most disruptive. In this case, it is likely that avoiding something is most disruptive than your attention, because attention is easier to give. And also, pain is usually stronger than pleasure. So the pain comes from wanting to avoid something, the pleasure comes from getting your attention. So whatever is more intense is probably what you want to address first. Pain is always going to be more intense, so you want to go for that one first. That makes sense.
So we have another one in the chat asking, so if their child melts down every time they say no to giving them candy, wouldn't the function of behavior just be that they want candy? Would there be any need to go any deeper than that to address that behavior?
That is a great question. It depends. It really depends on like the whole. What is it? Every time with candy, I would actually ask these questions. Is it solely every time with candy and nothing else? Is it a particular candy? Is it a particular person? Does the child ever request for that candy or accept the no for the candy from at any point, anytime in his life? Like, has he ever? Because chances are that yes, you probably don't have to go any deeper when it's like so clear like that. However, if you intervene, say you teach this child how to appropriately wait or tolerate the no, you telling him no and appropriately requesting the candy, and that still doesn't work, that is probably an indicator that there is something else underlying. So I would just ask more questions about the assumptions that you are making. It's so clear to you that it is because of the candy, but is it true? Does he do it with other people? Does he do it in other environments? Does he do it with other foods? Like, what else can we challenge about the assumption that there is nothing else that we can look into? Does that make sense?
Yeah, we also have another one asking about child personalities. So it seems like the mom's asking, what if my child just acts this way because that's who they are? Or does everything have to have a hidden reason behind it?
That's a great question. I would be curious to ask what it, when you say my child acts this way is because who they are. What do you mean by acts this way?
I'll have to look. I'll wait to see if she responds back, and then I'll get back to you on that.
Okay. Let me see. I think I got another one right here. I'm pulling it up. How can I tell if my child's behavior is something they can control or more of an emotional response that they need help managing? That is tricky for sure. You really have to consider the context of the behavior. Typically, what I recommend or what I say in those instances is if the emotional response is high, meaning, they really are crying, they seem distressed, excuse me, um, they seem distressed, there's like really an emotional response, more than likely we have to, regardless of whether it is something they can control or not, help them with that emotional regulation. So again, if the emotional response is high, very heightened, I'm sorry, something got stuck in my throat, but if the emotional response is high, severe crying, very anxious, very fidgety, like you just can't calm them down, you definitely want to focus on that emotional regulation first. And the first step to doing that is by showing them how to regulate. So, how you're regulating yourself, how you're modeling that regulation is going to be the best way to go about supporting emotional responses for your child.
We got another one, a little bit different, asking from a professional standpoint, when do you introduce behavior medication?
When so first, I definitely would recommend that you consult with your primary care provider, or if your child has a team of neurologists, psychiatrists, psychologists, all of that medical, we definitely don't recommend any medication. However, in collaborating with other professionals, medical providers of the sort, typically what happens is that when behavioral intervention has truly been like exhausted and we are unable to get the child to be in a state of learning, then that is when we would solicit recommendations from a medical provider. Basically, if I come in and I try all these things and this child is really never in a place in which we can teach them, like they're not regulated enough, happy, relaxed, and really engaged with us, then that's when I would recommend that we seek a medical opinion for medication.
Gotcha. We have a follow up question, kind of similar on the same topic, but they're asking about if their child is acting out because of sensory issues and they can't magically change everything. Like, wouldn't medication be a viable alternative, or what would be the appropriate thing that they should do for those?
Yeah, again, medication is out of my scope of expertise, but I would recommend that you seek additional recommendations from other providers. It sounds like if it's sensory related, maybe getting a second opinion from an occupational therapist might be beneficial. And then really talking to your primary care provider to see what your options are. I have seen it all work. With medication, without medication, in terms of sensory concerns. But then again, I'm unable to recommend on any of that. It really depends on the child. And I recommend that you just go to your medical provider and get that professional opinion from them. Now, another thing that it came to my mind is what you can do for sensory challenges is first thing again, like we're talking about, really identify when do they happen, when do those sensory challenges happen. Take a note of the events. What does it look like? Typically when you go to a provider like us or maybe an occupational therapy, if you tell us kind of like what the movements look like, when do they happen, we're kind of like able to at least create a clear picture of why it might be happening in the first place. But what you can do for sensory challenges is provide regulation at specific or sensory input regulation or sensory input at specific times. So for example, if you're having sensory challenges every hour or every 30 minutes, provide your child with that sensory input at that particular time prior to it happening. So if it happens every hour, provide sensory input every 45 minutes. And by sensory input, I mean movement, really jumping up and down, going in circles, moving your head from side to side is very helpful. All of that is to provide that proprioceptive input, which is usually what children with developmental disabilities struggle with the most. Do we have any other questions in the chat or anybody else?
No, that was it.
Okay. Well, I think this wraps it up. Thank you guys for coming, sending your questions. If you guys have anything else or anything comes up, please let us know.